Hi, my name is Kirby Piazza, and I will be discussing the condition dementia. I'm excited to present this information because I was able to learn a lot about this condition through this project, and there was a lot of surprising information that I learned throughout this process. Dementia is a term that I personally had a lot of trouble defining prior to completing this project. And it's understandable due to the fact that dementia is meant to be more of an umbrella term for a set of specific symptoms, which is something I had no idea. I thought it was just a straightforward diagnosis, not more of like that umbrella term like autism spectrum would be over a set of specific symptoms for autism. Um, I also didn't know that there was a difference between dementia and Alzheimer's disease, which I was surprised to learn that Alzheimer's causes the dementia symptoms, um, and that they aren't technically two separate things. In the new DSM-5, dementia's name has actually been reworked to help others better understand this concept that it's meant to be more of an umbrella term, and it's now called major neurocognitive disorder. Major neurocognitive disorder can be caused not only by Alzheimer's disease, but a number of different diseases or conditions like Lewy body disease, traumatic brain injury, vascular disease, HIV, Parkinson's disease, frontotemporal lobar degeneration, and others. A disease or condition does not need to be present to diagnose major neurocognitive disorder, as symptoms can stand alone with no root cause. According to the Alzheimer's Association, an estimated 5.7 million Americans are suffering from Alzheimer's disease, and it can be assumed that number would increase if the other conditions would be included in that number as well. 1 in 10 Americans over the age of 65 are diagnosed with Alzheimer's disease. And to me, that number makes it very clear why dementia and Alzheimer's are mainly associated with only those who are considered elderly, which I was guilty of that myself. But it is possible for major neurocognitive disorder to be diagnosed in anyone of any age due to the many different ways the disorder can onset, like having a traumatic brain injury, which can happen at any point in your life. According to the DSM-5, the main diagnostic criteria for dementia, or MND, is a decline in one or more of the neurocognitive domains. The neurocognitive domains are complex attention, where the person has difficulty in situations where there's a lot of stimuli. They become easily distracted due to the excessive stimuli. They have difficulty learning new information or reporting on information that was recently given to them, and they have longer processing times. The area of executive functioning, which is where the person can only focus on one task at a time, and they're only completing simple tasks, or they're choosing to only complete simple tasks. They rely a lot on others to help them in their decision making and activities of daily living, like getting dressed in the morning, cooking for themselves, things like that. Um, in the area of learning and memory, the person will often repeat themselves a lot, which typically tends to be one of the more defining symptoms. A lot of people will associate um, dementia or Alzheimer's with somebody not being able to um, keep track of what they're saying or repeating themselves a lot, or um, not remembering a lot of stuff. So the memory issues is a big part of that. Um, they'll also have trouble keeping track of things. They'll need a lot of reminders to stay on task or remind them that they were doing a task in the first place. Often people will just kind of walk away from what they were doing without realizing that they were in the middle of doing something. So that is one of the markers. The area of language, They have problems with expressive language and will often, again, repeat themselves. They'll have trouble communicating more specific ideas and will have trouble coming up with um, more like abstract words or just words to describe things. They'll often use terms like, you know what I mean, or that thing when trying to describe something specific because they're having trouble remembering what the name is. Um, they have trouble remembering other people's names or will often refer to other people by just their identifier, like Doctor or Mrs. Their sentence fluency is pretty poor, and sometimes they won't communicate at all. That is one of the um, problems with language. If they don't feel like they're able to communicate, they might just choose not to. In the area of perceptual motor, they'll have trouble doing activities like driving a car, writing, or other everyday typical activities that they were once able to do pretty independently. Um, they'll have a lot of confusion at nighttime with the location of things due to shadows changing their perception. So, doing things in the dark or at dusk might be very challenging for them. And then, lastly, the area of social cognition. They'll have trouble with socially acceptable behavior, um, or socially acceptable dress, like they'll dress inappropriately for the weather, um, and then socially inappropriate conversation. And then they have trouble reading social cues and have limited safety awareness. So typically, when these concerns are becoming apparent, the reports are coming either from the person that it's affecting, a family member or a close friend, or a clinician who may have seen the changes happen over time. Once it's been established that there may be or there is significant neurocognitive declines, testing may be conducted to either confirm or rule out the presence of dementia or another neurocognitive disorder. Some of the tests that are administered uh, is the Alzheimer's Disease Assessment Scale Cognitive, or the ADAS Cognitive, um, which that is an 11-part test which assesses for the level of cognitive decline by asking questions associated with attention, language, executive function, and memory. The clock drawing test evaluates for visual spatial issues and also perception. Um, it also assesses for memory declines and difficulty with concentration. The NPI, or Neuropsychiatric Inventory, is a screening tool that is typically completed by a caregiver or a family member or anybody that's close to the person but not the person themselves. And it has the ability to assess not only for Alzheimer's, but for other forms of neurocognitive disorders. So it has more of a broad spectrum set of questions that can apply to the different neurocognitive disorders, not just Alzheimer's itself. And then lastly, but not least, is the Alzheimer's Disease 8 assessment, or the AD8. This assessment is a one that either the person themselves or a caregiver can complete, and it's more of a low level or an entry level test. I would say it consists of 8 questions, basically to designate whether or not they have a reason to be concerned with dementia or not. So the questions are more focused on performance of daily tasks and language, and they're yes or no questions. So you're getting very minimal information out of those. Typically with dementia or any of the neurocognitive disorders, you're seeing behavioral changes along with that diagnosis. many of the typical behavior changes that are occurring are also common in other mental health disorders, such as depression, schizophrenia, delirium, and then they also fall into some other categories. But those three seem to be the most common that it gets confused with, especially if they're being seen in older adults. Um, in depression, this depression can co-occur with dementia, but depression is also a symptom of dementia. Um, and it's very difficult to differentiate between the two if the depression is occurring because of the dementia or if the depression is standing alone and the dementia is standing alone. Um, in dementia, the symptoms tend to be more consistent. So the depression symptoms are happening on a consistent level and there's not much change in them, where in just depression, they tend to vary more, especially related to the performance tasks. For a little while they might not be completing tasks or might need help doing them, but then at other times they might be fine completing them on their own. Um, Depression is also very common in those who have dementia due to the chronic nature of this disorder and the feelings of helplessness and hopelessness. With schizophrenia, um, the similar symptoms between dementia and schizophrenia are having delusions. Sometimes people have hallucinations, disorganized speech, some diminished emotional expression, and they're grossly disorganized. Um, the symptoms in schizophrenia often go through phases where they're more or less pronounced, where the symptoms with dementia only become worse over time, and they tend to be more consistent, just like in depression. And then lastly, delirium. Uh, delirium is a disturbance of attention or awareness, which is represented by a change in baseline cognition. And it also develops over a very short amount of time, where in dementia, it occurs over a significantly longer amount of time, where you're having those disturbances in attention and awareness. Delirium has links to direct physiological reasons or other medical conditions, such as drug or alcohol intoxication or side effects to medication, where you wouldn't find that with dementia. There wouldn't be that link. Delirium and dementia can occur at the same time, but that's where, again, it becomes very difficult to distinguish between them unless the person is monitored really closely, and you can see where the change is between those two symptoms. The behavior changes must stand independently and cannot be explained by having another mental health diagnosis. So this is where diagnosing somebody under the age of 65 could be very difficult, and the onset of another mental health diagnosis could coincide with the onset of dementia symptoms, especially if it's due to something like a traumatic brain injury, which can happen again at any time in your life. So we have to be really careful with differentiating between the diagnoses and kind of looking at what the cause is and what context those symptoms are happening in. Attached is a link to the video titled Living with Dementia, where several older adults living with dementia describe their personal experiences with the disorder. From their stories, you can clearly see the broad spectrum of symptoms that they all experience, but also the similarities in their stories. I found this video to be both really heartbreaking and also eye-opening. The level of awareness in their current state is surprising, but it also contributes to the many negative symptoms they're experiencing as well. I really hope you enjoy it, and I hope you learned something new from it, just like I did.